And now there are two. Late today, the FDA giving its stamp of approval to the COVID-19 vaccine created by Moderna. That goes with the one from Pfizer, which is in its second day of delivery across America.
That's right. So frontline healthcare workers in Abilene are anxiously awaiting the arrival of Pfizer's vaccine, expected to come later this week. But for the general public, it could be a while before we're able to get those shots. KTAB's Mercedes Hernandez has an outline of who's next on the list in tonight's top story.
With the first round of COVID vaccines on their way to sites around the nation and 3,000 en route to Abilene, we know frontline workers will be the first to get it. But what about the rest of us?
Sometime in the summer is kind of what we're thinking at this point.
Abilene-Taylor County Public Health District Director Annette Lerma says winter and spring could have come and gone before the general public will be able to get the vaccine. And that's due to a couple factors, from manufacturing to the state-led distribution plan.
You basically tell them what is your capacity for storage, and they allocate you whatever vaccine is available.
Once healthcare workers get their vaccines, that effort expected to be completed by January. Next up would be private medical practices and others that could frequently come in contact with the virus.
Freestanding emergency medical care facilities, normal physicians and nurses, school nurses, funeral home workers.
It could take several months to get those essential workers vaccinated.
That time frame is February to July.
But once that's done, depending on supply, the public could be next, something the Public Health District is already planning for.
We have everything from mass vaccination planning, where we do something similar like we did with the flu at a large site, and planning to have like a drive-through scenario.
As the public anticipates the vaccine's arrival, Abilene Mayor Anthony Williams encourages residents to keep their wits and their PPE about them.
We need to wear a mask. We need to abide by parameters by CDC and use good common sense.
We could be entering the final chapter of the pandemic, and these last few pages will hopefully provide a happier ending, and fast.
It's an answer to a lot of prayer, and we're hopeful that it will be the beginning of the end for this pandemic.
In Abilene, with coverage you can count on, Mercedes Hernandez, KTAB News.
Thank you, Mercedes. Also during this first phase are long-term care facilities. However, at this time, they have still not been allocated any of those vaccines.